Today, we're going to explore the prescription titled Metoprolol, or could be called also low pressure. The important information that you want to take heed of is you want to take this with or immediately after food. This medication may cause dizziness and drowsiness. We want to make sure we're using care when operating a vehicle, vessel, or machine. And we want to take this exactly as directed, and we don't want to skip doses or discontinue, especially without consulting your doctor. Uh, so when we look at what is metoprolol used for, it's used with or without other medications to treat high blood pressure, which is also called hypertension. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. And it is also used to treat chest pain, or also called angina, and to improve the survival after a heart attack. Metoprolol belongs to a class of drugs known as beta blockers. You may have heard of beta blocker, the terms beta blockers, but not know exactly what that includes. Metoprolol is one of those. This medication works by blocking the action of certain natural chemicals in your body, such as epinephrine, on the heart and blood vessels. This effect ultimately lowers the heart rate, blood pressure, and the strain on the heart. How do we use? We definitely want to look at that warning section. We want to take this medication by mouth or right after a meal as directed by our doctor, usually 1 to 3 times a day, depending on the dose. And the dose is based on your medical condition and the response to the treatment to that point. Uh, to reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. We want to use this regularly to get the most benefit, and we like to use, if possible, this at the same time each day. We don't want to stop suddenly taking this medication without talking to our doctors. Your condition may become worse when the drug is suddenly stopped, which is why we want to talk to our medical provider or doctor. It may take several weeks before we get the actual full benefit of this drug. May not happen overnight. It may take several weeks. We want to keep taking this even if you are feeling well. That sometimes happens as we start feeling okay, like, oh, I don't need to take this anymore. I've done that before at times, and it is not worked out to my benefit. Most people who have high blood pressure do not feel sick. So we want to look at to prevent the chest pain, a second heart attack, or migraine headaches. It's also important to use this as regularly as possible, and this should be used should not be used to treat the chest pain or migraines when they occur as a quick fix. Use other medications to relieve sudden attacks as directed by your doctor. For example, nitroglycerin tablets placed under the tongue for chest pain, triptan drugs such as sumatriptan for migraines, and we want to consult our doctor and our pharmacist for details. If your condition does not get better or it's getting worse, please let your doctor know. Uh, Meaning, if the blood pressure remains high, increases, or chest pain or migraines occur more often. Lastly, side effects. We look at metoprolol can cause drowsiness, dizziness, tiredness, diarrhea, and slow heartbeat that may occur. Also, decreased sexual ability has been reported rarely. If any of these effects last or get worse, tell your doctor or your pharmacist promptly. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a lying down position. This drug may reduce blood flow to your hands and feet, causing them to feel cold. Smoking can cause this to worsen. Dress warmly, avoid tobacco use. Remember, this has been prescribed to benefit you, as the benefits have been deemed to be outweigh the not using this medication. If you have serious side effects, including very slow heartbeat, fainting, blue fingers, toes, new or worsening symptoms, very slow heartbeat, heart failure, such as a shortness of breath, swelling of ankles and feet, unusual tiredness, unusual sudden weight gain, mental mood changes such as confusion, mood swings, depression, and there is also a very serious allergic reaction that could happen, but is very rare. And we want to get medical help as soon as possible. So this has been a video that we have been doing on different medications to give you some additional information that you may not read through the fine print, which sometimes I fall to that as well. And so this video is based on the medication, metoprolol, low pressor, all ways to say that the name and then the generic name as well. So metoprolol is the generic of low pressor. Low pressor is the brand name. Stay tuned, subscribe to our channel, follow us. You can find our Voices for Voices TV show and podcast on all your favorite streaming solutions, audio platforms. You check us out on Rumble, YouTube, Vimeo, Dailymotion, and we talk about the audio, Apple Podcast, Spotify, you name it, we're on it. We'd love to have you join us and share your feedback. So until next time, this is Justin. Take care.